Liftoff of mission 41D, first flight of the orbiter Discovery, and the shuttle has cleared the tower.
Welcome to the Health or High Water
Welcome. It's time to dive deep into the world of well-being. Explore the fascinating intersection of health and wellness. I'm your host, Trip Parks, joined by my esteemed co-host, Brett Hutari. Each episode, we're committed to bring you valuable insights, thought-provoking discussions, and practical tips to help you navigate life's challenges with resilience and vibrant health. Together, we'll navigate the currents of conversation, share expert insights, personal stories, and actionable tips. We want to express our heartfelt gratitude to you, our listeners, for your continued support and engagement to drive this podcast forward. We are honored to have you on this journey with us. Today, we have a very special guest joining us. Dr. Niki Popper is a licensed doctor of physical therapy with a degree from Denver Anschutz Medical Campus, as well as a BA in psychology. Dr. Popper's practice is located in Greenwood Village inside Fertile Grounds Wellness Center, where she specializes in pelvic health, among other things. Her dedication to her craft and practice is truly remarkable, and we are so grateful she could be joining us for this fascinating discussion. Dr. Niki, thank you so much for being here.
Thanks, Trip. Thanks, Brett. Thanks for having me. I'm excited to be here.
Thank you so much. You guys are jumping into the conversation. We've already started it, and we decided to jump on the podcast quickly because we were already diving into some incredible topics. Once again, thank you so much. We're glad you could take your time out of your busy schedule. So, physical therapy originally, correct? Was that like the first, when you first started, did you want to get into personal training? Was it right away you knew you wanted to do physical therapy?
So I studied psychology in undergrad. I wanted to either be a medical doctor or a psychiatrist. So I went down that path in undergrad, and then I was doing research with one of the professors at DU when I graduated, and I was going to pursue getting into graduate school there for my PsyD. And in that process, we were doing a lot of research, a lot of reading, crunching numbers, computer work, not a lot of person-to-person interaction, which was really what interested me in those professions, helping people, talking to people. I was interested in being a teacher when I was younger, but I frankly thought I couldn't make enough money doing that to live the kind of life I wanted to live. So I thought maybe those fields will kind of combine these things. And then I really wasn't happy in doing that research, and my advisor there was a great mentor to me, and she really helped me realize that wasn't the path I wanted to go down. So my now husband, then boyfriend, and I did a lot of traveling, a lot of international travel, and in that traveling did a lot of different odd jobs, and I found the things that I consistently wanted to do were fitness related, teaching related. And from there, I thought maybe physical therapy is actually a better direction for me. So when we came back to the States, I went down the phone book, starting at letter A, and started just calling physical therapy clinics where I could go in and be an aide just to get an idea of what that might be like. Did that, loved it, was for sure this is what I want to do. And then I started taking the prerequisites to get into physical therapy school, which took me a long time because there were a lot of prereqs I hadn't completed as an undergrad, and some of them had expired by that point. So fast forward, I'm at that PT clinic. There's an opportunity to get certified to teach Pilates, to do some other fitness classes called Gravity Group Fitness, to teach spinning there. So I got certified, started running their wellness program. The name of that practice was Ascent Physical Therapy Clinic. Ascent. So another reason the universe kind of maybe drew me to you guys. Okay. And I did that and loved it. And they had a pelvic health PT there who was also a professor at Regis, who started sending me some of her clients that were done with PT but still needed some specialized training for their various pelvic health conditions. So postpartum recovery, prolapse recovery, pelvic pain, that type of thing. And I was just fascinated, blown away. The impact on their quality of life was so much more substantial than those patients who were coming in for knee rehab. Not that that's not important, but when you help someone go from being completely incontinent and not being able to function, and we know that might lead to earlier admittance into a nursing home later in life, and a whole sequela of mental health dysfunction that comes from pelvic floor dysfunction. It was just wow, we can make such an incredible impact with a short amount of time and information given to these people, and I just was so passionate from there.
So going back to Anschutz and kind of going through that in doing the psychology and then getting into the physical therapy. What's your advice as physical therapists now coming into it, and even in the last 7 years, I wanted to be a physical therapist too. I eventually became a personal trainer. I think some of the money was an issue for me too that they're asking. So can you shed some light too on maybe somebody listening to this who may want to be a physical therapist? Was it easy? Was it hard? How was it?
It was hard, much harder than I thought it would be. You pay, physical therapy programs are part of the med schools. So CU Anschutz is where I went. There's only 2 physical therapy schools in Colorado, Regis and Anschutz. All physical therapy programs now are doctoral programs,
Yep.
so it's a clinical doctorate, much like what a chiropractor would have or a dentist would have. It's much more similar to a dental degree in the length of schooling. So to get into physical therapy school, you have to have an undergraduate degree, and ideally that undergraduate degree covers the prerequisites you would need to get into physical therapy school. In order to have that, you need to know that you want to do physical therapy school as an undergrad. I didn't know that, so I took a while to get those prerequisites.
Yeah.
So what I would say to someone who's considering it, certainly if you are going into undergrad or you're in undergrad, take a look at those prerequisites and try to knock it out while you're in undergrad, because it's a lot of time and money afterwards. But that said, there's a lot of value to coming in to physical therapy school as an already experienced, can't say practitioner, but professional. So I had already been working in that setting for about 6 years before I went to PT school. So I had an edge on some of the classmates in my program just from real life experience. But PT school was like trying to breathe while a fireman is spraying a hose at your face. I mean, I was floored. I had never struggled in school. I was a very good student. I got a scholarship to DU. That's what brought me out here for undergrad in psychology. I had never struggled in school. The prereqs were hard, but I thought this is hard because I'm working full time and going to school at night. But then PT school came, and I felt like pretty much every day of PT school, I might not graduate. This dream might not be realized. What am I thinking? Can I actually do this? And then at graduation, I won an award, and I was flabbergasted and kind of like, I don't know what it'll take for me to believe this. Then it was, am I going to pass my boards? Then I passed my boards. Then I, working for practice for 10 years, and then starting my own business. And it's kind of this constant like, wow, like if I dream it, if I believe it, if I work hard enough, it can happen.
And that's part of a little bit what we try to teach in personal training. Is not just like, hey, this is the right form. It's like trying to build that confidence up in people. Some of these people have never been to a gym, never seen a gym before, never picked up a weight or whatnot. Your people probably never been to a PT before, don't know how that works or whatnot. We just trying to instill confidence is kind of hard, especially in yourselves when we're going through something. Like when I was finishing my genetic certificate, I was like, I barely passed that like low level science in high school. Like the very low level is it's like for not as smart kids at science and math.
Yeah.
That's the imposter syndrome, like where you never feel like you're good enough. Mentor, somebody in that time period, like as you're going through school, was there somebody that stood out that kind of made a big change for you?
Definitely. So my clinical instructor so in PT school, you go through, at CU Anschutz, it's 3 years full time. And then within that program, this has shifted now, but you have clinical rotations, which are much like residencies for a medical school. So at CU, when I was there were 4 main clinical rotations. By your 3rd and 4th, you're expected to take on kind of your own caseload under supervision with mentorship. So for my 3rd clinical rotation, I knew that I wanted to focus on pelvic health, but it was hard to find a mentor in pelvic health, in large part because it is a specialty and it is so private that it's hard to get patients on board with letting a student be the one working with them. Sure. And there's a number of variables there why that is challenging in this specialty. But I was able to get in on a clinical rotation with Dr. Lori Buxton, who was the owner of the clinic where I worked for 10 years, Integrated Physical Therapy of Colorado. She's recently retired, sold that practice. But she took me on as a student, reluctantly. She did not want a student. I essentially begged her to take me as a student. And she introduced me to her dear friend, Dawn Sandal-Cheedy, who is a very well-known leader in the pelvic health world, specifically for pediatric pelvic floor physical therapy. She's an internationally known lecturer. And both of them are quite well-known in their own rights. And Lori and Dawn really took me under their wing, and they both told me at the time as a student, we're going to hire you when you graduate. We want you to be a part of this for good. Like, you've got a gift here. And once again, I was humbled and kind of like, what is it? Like, what? I can't believe you feel this way about me. And, it was great. They helped to build my confidence. And here were these two really powerful women that also had families and just really had a balanced lifestyle from what I could see. And they mentored me through the remainder of PT school. And then I worked for both of them when I graduated, and they continued their mentorship with me for about another 5 years. And then I worked for Lori for another 5 years after that. Not so much I was more of a mentor to other employees than at that practice. So I got to kind of pay it forward from what I had worked with several students and new employees. And Lori is still very much, I text her pretty regularly for advice, and she cheers me on for a variety of reasons, and me to her, and that's huge. Especially in pelvic health, you really need mentorship to know how to apply the concepts. It's all pretty much postdoctoral training that you get in pelvic health, and you can go to a course all weekend and we round robin on each other. We're each other's patients. I can elaborate on that if you're wheels are spinning there.
Absolutely. Oh yeah. Yeah.
But so like when you take these courses, there might be like 30 participants, and it's okay, 15 people on the table, 15 people are the practitioners. Now we're going to do the whatever evaluation it is. It could be a coccyx evaluation rectally. So then like ding, next person goes, you go to the next table. So you've got like 15 inexperienced pelvic health wannabes doing vaginal and rectal palpation. They don't know what they're doing.
Trying to picture this in my mind.
Yeah, I can.
15 tables all set up, the feet are all up. And
it's very, we're draped. It's very, very scientific, very comfortable as it can be. But you leave those courses with a lot of hands-on work, but you're working on each other. So you really need to practice with a real patient population and just reps, like doing more and more of it. So you really know how to have the right bedside manner, critically think and have clinical reasoning from the get-go. And a lot of pelvic health PTs lack that. They can take all the coursework, but if they don't have someone to mentor them who can say, okay, I'm going to palpate this person's pelvic floor and tell you this is what I'm finding, or you tell me what you're finding, I'm going to tell you how that compares. That is I think an essential component to becoming a well-qualified pelvic health therapist.
Do you think that, so obviously knowledge without application and use is pretty relevant, right? So do you see that a lot in your industry with people that they're super well certified, but they can't apply anything to it? I mean, extreme case, but.
Yeah, I mean, I think you can find that in any industry, certainly. Like, I think oftentimes that's like the difference between like book smart, street smart in a way. Like, and there's a lot of clinical training in PT school. So by the time someone comes out of PT school, they are well qualified to begin treating patients.
Right.
But certainly the expertise, to be able to call yourself an expert, to be able to call yourself a specialist, I do see a gap especially in something like pelvic health, where there is just a tremendous gap in how many people are seeking care and how many qualified providers there are to give it. We see a lot of folks coming out of the woodwork now that are quote unquote pelvic health specialists, but they've taken one or two of the courses, or they're saying they're a pelvic health specialist, but they're not performing internal work. And I think that, they have a lot of value, but it's critical that we know our own limitations as providers, and we always know when it's time to refer out, when something is not either within our scope of practice or within our skill set. So it takes some time, I think, to learn how to leave some of the ego at the door and know when to refer.
I agree. We see this a lot in training a nutritionist, and as well as overall perspective, right? So you have let's say you have one person with a problem, and then you see a nutritionist. It's like, well, that nutritionist is going to see it through nutritionist eyes, right? It's like, well, we're going to solve that with a nutrition problem. A personal trainer is going to be like, well, you're not working out enough, and figure out that. So we see a huge perspective issue in our industry, right? And every single one of those has its point in place. Physical therapy, sleep, stress, hormones. There's a good part to pick, and we see extremism views and everything like that when everything has a balance to it, right?
Of course.
So what is pelvic health for us guys, right?
Yeah.
Us guys, What is the importance of pelvic health? What are the issues, the primary issues you're seeing?
So men have a pelvic floor too. Everyone has a pelvis. I often say that to my male patients. And there's actually only really one muscle that's different for male versus female pelvic
So you
floor.
do have male clients?
I do.
Oh, okay.
I do.
Okay.
The bulk of the patients that I see are women, but I do treat men as well with pelvic floor dysfunction. Depending on what that is, if someone were to reach out to me, I might say, hey, reach out to my other colleague who does more of this than I do. But some of the common conditions that I would see across all genders would be urinary incontinence. So there's two types of urinary incontinence. Well, there's more than that, but the two types we mainly see are stress incontinence, so leakage with laugh, cough, sneeze, jump, basically a mismanagement of abdominal pressure. And then there's urge incontinence, so leakage when you have an urge to go, like can't make it to the bathroom on time. There's other types of incontinence, but those are the two main ones that we would be treating in a pelvic floor practice. We also see a lot of pelvic pain, so really common in men and women. A condition called pudendal neuralgia is really common in Colorado because of the big cyclist population. So we see, as every type of injury and dysfunction, there's a lot of relationship to the activities that people do. So there's some demographics on the type of patients we would see in a place like Colorado, where people tend to be more active, up in the mountains, more weekend warrior type of injuries. Then I see prolapse as well. So prolapse is the dropping of the organs. That is something that occurs to women. Childbirth is vaginal childbirth is the biggest risk factor. 1 in 5 women that deliver a baby vaginally will develop a pelvic organ prolapse.
Really?
Yes.
Wow.
1 in 5.
Yes. So the statistics on pelvic floor dysfunction are staggering. It's incredibly common after a vaginal delivery to have pelvic floor dysfunction, leakage, pain, and that could be bowel leakage. So I also treat a lot of fecal incontinence, hemorrhoids, difficulty going to the bathroom. So I'll work with patients who are retaining urine or having to use intermittent catheterization to empty. Then I also treat a lot of diastasis recti, so abdominal separation postpartum. It goes down such a long path from there. Obviously, you can think of all the things that would kind of interconnect with. And, we talk a lot about nutrition, hormones, the things that aren't necessarily completely in our scope of practice, but really trying to look at someone from a full person, whole person picture, and understanding that we can't just isolate, while pelvic health physical therapists focus on the muscles and the tissues around the pelvis. That's how I would kind of delineate what a pelvic health therapist is compared to a general physical therapist. We are experts in the musculoskeletal system in general, but pelvic health therapists are experts in the pelvic component of that. So,
is there? Sorry to jump in on you there.
That's okay.
Is there there has to be a population that is having these issues? They're having incontinence, and there has to be some sort of I don't want to say embarrassment, but they're I don't want to go see. I don't want to go. I'll go next week. Do you see that? Do you see people that are coming to you that are I should have gone 6 months ago?
Every day.
Okay.
Every day.
Okay.
And I mean, that drives so much of my passion, experiencing that as a mother. What really got me into prenatal postpartum care was having my own kiddos and realizing that even as an expert in pelvic health, I was blown away by the lack of information that I received and continuance of care. And if I didn't know what I know, I never could have recovered in the way that I've been able to. And there is a ton of shame in incontinence, and it's incredibly common. We know that at least 1/3 of women after postpartum delivery are going to be experiencing incontinence. And those numbers, I'm sure, are actually higher than that. These are kind of taboo topics that people don't like to talk about. People like to joke about it. Products are out there there are tons and tons of products for leakage. Pads, special underwear, the Emcella chair, all these ridiculous products that are claiming they're going to give you a quick fix, much like I'm sure in personal training, if someone tells you you can stand on a vibrating plate and you're going to have a 6-pack, it's probably not true. If you sit on a chair that vibrates your pelvic floor, you're not going to have no pelvic floor dysfunction. It's just not true.
But I saw it on TV.
Exactly. So marketing and what is out there, what is presented to the public is not, hey, this is a problem that can be solved. It's, hey, here's Band-Aids because inevitably you're going to leak. You had a baby, you're going to leak. And what we like to say is common, not normal. And we see as well that there's a huge gap in the medical profession. So biggest problem is that, and there are so many wonderful providers out there that are doing a great job of this, and it is slowly but surely changing. But so many of my patients are told, I just saw someone yesterday who was told she's experiencing fecal incontinence, urinary incontinence, pelvic pain, digestive dysfunction, a slew of other problems. She had stage 3 tearing with her first birth, which a stage 3 tear is going to go into the anal sphincter. Those patients require rehabilitation to be continent with their bowels. So she has a 2-year-old. She's had fecal incontinence for 2 years. She's experiencing it worsening in her pregnancy. Her OB said to her, let's wait till you're done having babies, then this can be addressed surgically. And really, sadly, that's something I hear all the time. She actually heard me speak at Rose Mama Circles, in which someone said, how do I know what's normal pregnancy problem and what's a pregnancy problem that should take me to a physical therapist? I said, if you have pain, if you are leaking anything, if you can't get things out and you can't get things in, you need a pelvic floor physical therapist. That is not just an inevitable, you have to experience that because you're pregnant. But much like postpartum care, women are really kind of pushed to the wayside. Like that's not a big deal. That's not that important. And it happens to men too. They're told, oh, this is a prostate problem. Go on X, Y, and Z medication, or, hey, you need to have your prostate removed, or this type of procedure. But they're not really told how the musculature might be changed in that process. And the truth is, those medical providers, urologists, OBGYNs, they are not the experts in the musculoskeletal system. I don't want to deliver a baby. Patients don't want me to deliver their baby. I'm not at all qualified to do that. But their OB is not at all qualified to help them rehab their pelvic floor either.
Go ahead. So we're kind of talking about the after effects, right? And one thing that we really like to talk about is preventative health. Like let's think upstream thinking. Like what can we do to prevent these problems happening to begin with, right? So again, my brain's going nuts right now. I have like 1,000 different questions to ask right now. But so talking about preventative stuff, like let's say there's a staggering number of people, mostly women, but even men with these problems. Do you see anything like posture issues before they happen, or like anything like that that's causing these to happen so frequently? And what's kind of your expert opinion on that?
That's a great question, and so much of where I hope medicine in general moves in health and wellness, right?
Yeah,
we're such a reactionary medical model. And we see that in PT too, and I think across the spectrum of healthcare providers. But, there's a lot of ways to answer that question. But I think one thing I like to think about for preventive-based care that I'm often just talking to OBs about is when someone gets, and I'll tie this to other things than just pregnancy, but when someone gets pregnant, they are required to sign up for classes on how to give birth to the baby. Usually if it's a hospital setting or even a birth center setting, they have to take classes on that, how to give birth. They're typically encouraged, if not required, to take something on feeding baby, caring for baby. So breastfeeding classes, labor and delivery classes. And it goes way beyond that for the classes that people take, and they're expected to get this preventative-based education. You've never had a baby before, so somebody better teach you how to feed the baby, how to take care of the baby. Well, your body's never gone through pregnancy before either. So is anyone teaching you how to prepare your body for that? How to recognize things that are abnormal and how to prepare for inevitably the massive changes that are going to happen? No. That's really not out there. So what we really need to be doing is seeing people and talking to people about pelvic health before they have a problem. And to expand that, we can go all the way back to childhood and the way that we are potty trained. And this is applicable to everyone. So I often talk about this. Wonderful parents unknowingly instill very bad bladder habits in their kids. If we are teaching folks, you better go to the bathroom every time before you leave the house. Oh, better go now. We're not stopping. You are teaching people not to listen to their body's cues. And the way that the bladder, brain, and pelvic floor work on a neurologic standpoint, it's a learned behavior. We all learn potty training. We don't, well, hopefully, we don't, coming from someone who's trying to potty train my 3.5-year-old twins, I'll get back to you on that. But the bottom line is, we don't have conscious control over our bladder, right? We can't tell our bladder, okay, empty, okay, hold urine. We think that we can do that, but what we're really telling to do that is our pelvic floor. So when you hold back urine, you're sending a signal from your brain to your pelvic floor. That communicates with your bladder, but you don't have a direct path to be able to say, okay, bladder, go ahead and contract. It's your pelvic floor that contributes to that signal. So when we teach kids or adults, or this happens all throughout life, to not listen to the bladder, but to listen to the schedule. Okay, I'm gonna force myself to go right now, or I'm gonna hold it really long. Or even worse, I'm not gonna drink anything because I don't wanna have to get up and go to the bathroom during this meeting. You're really changing neurologic pathways, and you're training the bladder muscles to work in a non-optimal way. So we really wanna be teaching people from an early age just the basics, like just what I said. Hey, it's your pelvic floor that's actually, doing a lot of this. And if you go when you don't need to go, you teach your bladder muscle that it doesn't need to expand as much, and pretty soon you're going to have to be going more often.
Right, so you're based off the epigenetics of it, like your surroundings, like that's affecting what's going on instead of like your natural form and function.
Yeah, 100%. There's something called key and door phenomenon that's incredibly common, where folks will report incontinence with, it's not always key in the door, it's often unbuttoning the pants, opening the door. I see this a lot in men, fumbling to unbutton pants, and urine starts to come too soon. And what that is, it's environmental. It's the bladder knows I'm close to the bathroom, or, okay, it's almost go time. It gets the signal that it's go time too soon. It's a neurologic dysfunction. Those folks don't need weeks of strengthening. Literally, they come talk to me one session, not always this simple, but very often. I just teach them this anatomy on a little bit more of a detailed level. I teach them some ways to recognize their bladder cues and change their behaviors, and the problem goes away.
That's so interesting. So, so basically what she's saying is, your environment, you go to an environment, let's say the bathroom, and then your brain starts to release the chemicals, tell you it's time to go to the bathroom, right? And then you start going.
Yeah, it's super interesting too, because it's the intersection. I can see so much of what we do too in this is like listening to our body's natural rhythm, and this is the perfect segue into nutrition, into intuitive. And I'm super excited to hear your take on nutrition, but intuitive eating and taking somebody who's had horrible eating habits their entire life, retraining that, and then we can get into like sugars and stuff like that, but. How to begin to start to listen to your body's natural messages to your brain. And you got into, so it's such a cool intersection. So as far as let's go into nutrition now. Is that part of your practice now? How do you incorporate that?
I am learning more about nutrition right now because it's so obvious that it's a glaring problem for so many of my patients. And having been a patient myself, it's really hard when you go to a provider and like, well, you need to go see this specialist and this specialist and this specialist. It's like, isn't there a one and done? Can't I go to a one-stop shop? So I do talk about, I do talk a lot about nutrition, and we have a lot of training on every body system in physical therapy school. But I wouldn't consider myself right now qualified to do any type of like functional nutrition, certainly no testing, no elimination diets, things like that. I'll talk to folks certainly about bladder irritants, and there's a lot of links between what we drink and eat and bladder health. So I definitely go into a nutrition realm with that, as well as a lot of bowel and urinary dysfunction links back to digestive health. Constipation being like the number one enemy of pelvic floor dysfunction. So I am talking about pooping, peeing, eating, drinking at every session.
Do you deal a lot with IBS patients?
Tons. And I mean, that's kind of like a fibromyalgia diagnosis, right? Like, we don't know what's wrong with you, so we're going to call it this. That is a description of a symptom. It's not a description of a pathology. Right. So, I mean, what we're really seeing in our patients is a lack of understanding of A, how slow the gut microbiome is to change, B, that the gut microbiome changes a ton depending on what's happening in your life pregnancy, hormone changes, stress. I mean, so many things there, as you know. So when I'm treating patients, for example, with diastasis recti, and we are finding, okay, now your pelvic floor muscle function is excellent, well coordinated. Okay, your abdominal function is on the way. You understand how to manage abdominal pressure, but you're still reporting to me that by the end of the day, you look like you're 6 months pregnant and you're a year postpartum. But in the morning, you're content. That's not a diastasis recti problem. That is a digestive problem. Why is there gas being produced in your large intestine? Maybe you're not absorbing, maybe you're not chewing your food. Maybe undigested food is getting into your large intestine. Then I'm going to say, hey, I really think that your digestion's playing a role here. I'm going to give you the names of some of my favorite nutritionists who can see you virtually, who can do some testing, stool testing, blood testing, whatever it might be. Why don't you consider doing a consult with these folks and just seeing what they have to say? Because I think you've addressed the musculoskeletal component of this problem, and you've done a great job of that, but we haven't addressed the gastrointestinal component of this problem. And it's interrelated. And it's interrelated with your mental health too. So it's kind of picking like our battles, like what's our first place that we're going to pick, and also how can we incorporate all those things in one. So I'm slowly incorporating nutrition as I'm saying, here's why I need you to drink more water, and here's when I want you to drink that water. Here's why I want you to observe what this food is doing to you. Here's why, let's look at this Bristol stool chart and see what your stool looks like. Okay, here's some suggestions for how to get that stool consistency where it needs to be. And here's why it's important. I think if people don't know the why would they do it? Like,
for sure.
And so often with nutrition, that's the case. Like we're told, like, oh, drink half your body weight. Well, why? Eat this. Why? And I think if you really ask the people who are saying that why, they might not know how to explain that to you in a way that's even tangible. But if you say you're going to stop peeing your pants if you do this, boom, okay, I'll do it.
It's again, we're so used to being sold something that's the way we digest information, and that's again why we started this podcast is like, let's talk about the truths, let's talk about the best parts of all of fitness, and let's bring it together in a new perspective. So like you're saying, like all these are intertwined, but everyone's got their own perspective.
Totally.
Like we were saying in the beginning, again, a nutritionist is going to attack it as a nutritionist.
Yep.
But what the problem is, I think a lot of healthcare providers, they keep on trying to solve the problem themselves. The nutritionist keeps on trying to solve it with food, and it could be like a pelvic floor problem.
Yep.
But we need to be more resourceful with our surroundings, with partnering up with you guys. Let's say like we try the diet for someone else and they still can't control their stuff. Like I'm going to refer them to you because I don't know about it, right? Like we need to start leaning more on our experts around us to solve these problems, to end the frustration that these people are going through.
Yeah, I want to highlight something amazing. So there was so much great information on that, but I want to highlight one thing on that before we move on, is the stress factor from our perspective. That's the number one thing that I always look at coming in as a personal trainer is the lifestyle. What kind of lifestyle is this person living? Try to get an entire picture of their life, whether they have children, what do they do on the weekends, how long they're sitting on the couch, do they watch TV? And when we start to look at these stressors, one thing our audience listening to this, and I know, we're in the same realm with this, is stress is a killer. So, and we always have to be so weary of, what kind of stressors we're allowing in our lives, good ones versus bad ones. Starting a business, great stressor, right? Starting a family, great stressor. Too much phone time. Too much ignoring, procrastinating on things that you really need are bad ones. Okay, cool. So I wanted to touch a little bit on, there was something we were talking about before this podcast with a cool new endeavor you have in your business where, expecting mothers, you're speaking to them. Can we talk a little bit about like what exactly you do?
Sure. So when I worked for Dr. Lori Buxton at Integrated Physical Therapy, we had that was an insurance-based practice. So a lot of our referrals were from OBGYNs and kind of, like standard medical providers. And we recognized then that there was a gap in education for women on preventative medicine. So women are getting classes on childbirth, on feeding baby, on taking care of baby, but they're not getting classes and education on how to care for their body during pregnancy, afterwards, also what to expect. So this is like globally recognized as a gap, at least amongst pelvic health professionals, and even the American College of Obstetricians and Gynecologists is now recognizing this, although they have not implemented change yet to support the fact that they recognize this as a problem. But Lori and I were going in often and just having lunch with the OBs and kind of pushing and asking, hey, could we do a free class for your patients on preventative medicine? And we were shocked that very often it was, no, we'll have to see if we have the capacity for that. We already do a lot of classes. When should we send these people to you? Like, should we wait till they're done delivering? Like, how much leakage does someone have to have? Like, what warrants someone visiting you? And we're like, no problem. You can send them to us with no problem. They don't need a problem to come and see us. And we were just really disappointed by how hard it was, and it really never happened, to get into a hospital setting, essentially, to teach these classes. We just kind of couldn't get there. So we started our own class. At that time, it was called Labor of Love, and we ran that for a couple of years. Thanks. My colleague Susan Miller actually came up with that. Shout out to her. But so we taught that at the clinic, and it was good. I loved the class was great, but OBs still weren't really sending people to this. The way people were coming to that was word of mouth. Friends told them. So when I started my practice, I set out again with the goal of, if I go to an OB, I'm just going to see if this is something they would be interested in. And Jeannie Sullivan, just an amazing OBGYN. She won Denver Health Resident. I think that was like last year. She's a new OB, but she is phenomenal. And she reached out to me via email, said, I heard a patient talking about you in our hallway. She had an incredible experience at your office, and I'd really like to meet with you and learn more about what you're doing. I was like, that's amazing. Yes, I will come. So we did a roundtable discussion that she recorded, and that will be put on the UC Health website. So she's part of UC Health, and that's at Rose Medical Center. So that should be coming out in a couple days probably. But we did a big roundtable discussion about prevention-based PT. At the end of it, I said, hey, for years I tried to get into the hospital to teach this, never could. I just kind of can't understand why, but I still am interested in doing that if that's something you guys would be interested in having. A week later, she connected me with the person who runs Rose Mama Circles, which is they group mothers who are going to deliver at Rose in cohorts based on delivery date, and they do different topics with different experts, lactation consultants, doulas, sleep consultants, and pelvic health physical therapists. So now I'm one of those PTs that does that once a month.
Well, and everyone listening, just to give you guys an idea of, we're kind of going through the same thing with genetics and teaching people about that too, is number one, you have to identify a problem, right? Hey, there's a problem. There's a lack of information going on here. The same with me being a nutritionist and dealing with the food pyramid. A lot of people come to me and like, well, I used the food pyramid. It's like, well, that was outdated 10 years ago when I got out of high school, right?
At least.
Like there's simple carbohydrates are at the top. Come on, that's not a thing.
And funded by the dairy farmers or something.
Exactly, yeah.
Right?
Yeah. Don't they have
it was Kellogg's funded it.
Yeah.
Don't they have like Lucky Charms? Like
They did.
Is it like the AMA or something? They have like Lucky Charms above like steak or
Yeah,
something?
Kellogg's the company,
totally.
literally funded that to help.
We
different time.
could dive into that.
But number one is identifying the problem, and then after as a health professional, you identify the problem, then you have to normalize the problem. Right? And that's the issue going on there. It's like, well, there's a ton of people with these problems. They might not want to come to us with a problem. They might not know it's a problem. They don't know what normal is. And having to normalize this problem is incredibly hard. Yeah. But then once it catches, it's usually pretty good. But having to normalize that the problem that you're finding is incredibly hard. And we're finding the same issue. It's like the calorie in, calorie out. It's like, well, I understand like people do follow the law of thermodynamics. But some people have a different way that they burn fat than other people, or the way they process muscle different. So that kind of does break that, the second law of thermodynamics with digestion. So there's all these different aspects, and I love that I don't love it that you're having the same problems as us, but at least you understand, on our aspect we're going through too on our side, and hopefully this kind of stuff, talking about this out loud and other people listening will help normalize this issue.
Yeah, I mean, I think medicine in general in this country is in somewhat of a state of crisis. I think a lot of folks could agree on that, whether that's from an insurance standpoint and the cost of healthcare, accessibility to healthcare, or just reactionary medicine that's practiced. And I think thanks in large part to social media and I think the internet and access to information, albeit that can go south as well. But, people are educating themselves and learning to ask questions and know that a paternal model of medicine is not really working. When you go to see someone, you should have the time to be able to be looked at as a complete individual. What makes you tick? What's in your lifestyle that's important? What are your future goals? How are you feeling? Because just having a problem isn't the only thing that should warrant being taken care of. We should be educated on how our bodies work in a way to know how to prevent the problems from occurring to begin with. And if we're not taking the time to educate people first and foremost, that's where it has to start. Knowledge is power.
100%. And going back into the preventative health stuff, it's very hard to kind of figure out these problems, like to prevent them to begin with. With us, it's pretty easy. It's like, hey, you gotta control yourself at the grocery store, making sure those food items don't enter your house, making sure that, instead of going to the bar every night, you come to work out or whatnot, right? So do you see anything with like posture or skeletal frames or using the computer too much that's making these pelvic issues happen to begin with?
Absolutely. So from a lot of different standpoints. So, from a postural standpoint, certainly we can relate so many, even non-pelvic health related PT problems. Jaw pain comes to mind, neck pain, headaches, so much of how we sit throughout the day impacts our health, and in particular compression on the spine. So we know sitting is the most compressive position for the spine. We know that our discs increase in size overnight, so everyone's going to be a little bit taller in the morning than they were when they went to sleep. So just how much compression you're having on your discs, that can be really offset by putting a pillow behind your low back. But then if someone's not told, hey, you can also lean against the back of your chair, when you do that, they might develop some muscular spasm from just not knowing how to sit up straight or knowing why and how that's going to benefit them. And we can tell people all day, sit up straight, but if we don't give them the tools to do it, the muscle length and strength they need to make that happen, they'll fight an uphill battle and never achieve it. More than posture, I see the clock and the schedule dictating when people go to the bathroom, what they drink. That creates a huge problem for bladder health, especially if it's done over years and years and years. You can really retrain the bladder in a very negative way. Some of the professions that we see most often are nurses and teachers, because they cannot go to the bathroom when they need to go to the bathroom.
Gosh.
So their daily lifestyle and their workload determines their health.
Totally. Yeah, I see it all the time. I almost scoffed because I've heard that, and it hits me. I'm like, you have to figure out a way to you can't let your job ruin your health. You're like, I had a patient I couldn't eat. I'm like, well, if you do that consistently, so how do you get around that? What's your thought process? Because I could tell you what I think on that. But
to me, it's just education first and foremost. Talking to someone and giving them the time, which physical therapy is such a cool profession because we are one of the only healthcare providers that does get to spend this length of time with our patients. So we really have a unique opportunity to learn more about them where other professions they can't do that. But I think first it's just talking to someone and listening without interruption. I think the average patient is interrupted within the first 30 seconds of speaking to a medical provider. So if we can just let them speak, tell their story, if they first feel heard, then they're going to be a lot more inclined to hear what you have to say and absorb that. And then I'm taking into consideration what they're telling me. So if someone's telling me I have a really demanding desk job, I manage 3 screens, I sit at my desk for 8 hours, I don't have room for a break, then I'm going to be talking, okay, how can we fit in standing breaks to where you're sitting? Can you ask your employer for an adjustable desk? Okay, that's not going to happen. Okay, let's get a gym ball in the mix so you're sitting on a gym ball instead of only on your chair. Okay, could you talk to your boss about taking XYZ break? Can you put a Post-it on your computer that says stand, that says belly breathe, that says forward head, whatever it might be, rest position of the jaw, relax your feet? Could we put something under your desk so you could at least maybe do some pedaling or some ankle range of motion? What if we attach a TheraBand to your chair and we could get some bicep curls? That's a random example, but you get the point. We want to meet people where they are. There's not a one size fits all. So I think if we can listen to them and incorporate it in their life and make it feel easier, although it'd be great to go to the gym, hey, we can start with something smaller. Can you commit to 10 seconds tomorrow? Done. Let's start there.
So it's almost like health troubleshooting.
Yeah, 100%. We're detectives as PTs. I am constantly listening to my patients' stories from the moment they walk in. I'm observing them in my waiting room. How are they sitting in my waiting room? What's their posture? Because when they think I'm not looking, that's when I'm really going to get to see the most. Then I like to watch them walk back to my room. I like to give them a second just to get in my room, kind of orient themselves to the space, see my degree on the wall, kind of get some of the nerves out. Because a lot of times people are pretty nervous to see a pelvic health physical therapist. So I give them that moment. It gives me a moment to kind of take a breath, just like clear my mind before I treat my next person, but I'm also observing what they're doing. Will this person not sit in my chair? Why don't they want to sit? What's going on? So when I go in, I'm going to stand with them while we talk. Are you having sitting pain? That might be one of the first things I say. And then it might be, no, I'm just like super anxious to be here right now. I'm like, okay, well, what can we do to help you feel more at ease? And it's a constant detective work to figure out what's going to click with this person and how am I going to get buy-in from this person, not to build my business, but to help them. Like my biggest success are the patients who don't need to come back to me a second time. Right. That's huge.
Well, it's so funny you use the word detective. I'm going to go off on a tangent real quick.
Yeah, it's great.
He got really excited when I said that.
It's coming right out of Tripp's mouth. I'm like,
literally.
Oh, by the way, we're all standing. You can't see us right now, but we are all standing right now, so we're living it.
Yeah, I'm over here jumping around. I'm all excited. So before we opened the gym up, we were trying to figure out how to intertwine all these different things that we do, genetics and hormones and physical therapy and whatnot. And I was at home watching Criminal Minds, and they profile murderers, right? And I was like, what if we take a health profile, and that's where the book came from.
Where's this going?
Yeah, you have to become detectives in health. You know, it's the same kind of thing. So we're like, oh, we health profile. It's exactly what we're trying to look at, the entire picture.
Yes. And so much of medicine works that way. The problem is it's an algorithm based on pathology. So if you present to the ER and you don't have a clear pathology, they don't have a clear path to treatment. That's one of many examples. Whereas we can be detectives without having to have this perfect, nobody fits in that like algebraic equation, right? Like, yes, we have a pathway to decision making in physical therapy too. If someone walks into my office, I'm always doing differential diagnosis. If I think someone's having a cardiac event, I'm going to refer them, I'm going to call 911, right? But we have to know how to treat someone even if they don't present to us with this perfect pattern of pain. Like, or whatever it is, perfect pattern of dysfunction, because there isn't a one-size-fits-all for anyone, ever.
They might not be able to know how to explain it to begin with. What kind of pain are you feeling? Well, I've never felt this before. I don't know what to call it. There's a perception of that, but the doctor might not be able to get the right information from the client.
100%. Or like I might say to someone, hey, are you having any bladder dysfunction? I don't really phrase the question like that, but if I did, someone would probably say like, oh no, not at all. But then I could say, well, do you ever leak urine? Oh yeah, I leak every time I laugh, cough, sneeze. Well, that's a bladder dysfunction. How about like, are you having any constipation? No. Well, how often do you go? Once every few days. I'll just take a stool softener. It's like, no, that is constipation. Yeah. So people don't always know, to your point, that there is a problem.
Right. It's really about asking those right questions, and without the continued education and learning with anything in our industry, is you're not going to know how to ask those questions.
Yes.
You're not going to be more well-rounded in things. And like even after talking to you, like if someone does have those issues, it's like, well, I know that's a problem. It's like, hey, like you should not be taking stool softeners like all that time like that. I got to refer you to you. And that's a whole nother perspective that I never even thought of.
I love this conversation for so many reasons, but a big one is that it's preventive care. So you've heard it for the last 40 now minutes about preventive care. You don't have to be sick or ill to address these problems. They happen. They're normal. We all deal with them. And there are obviously some well-educated people that love doing this and teaching this. So, you're not alone. I think that's the big thing too, is that people aren't alone. COVID was tough and we're still feeling the after effects. How was that for your practice? Did you shut down? How'd you get through it?
Well, I was that was a really unique time for me because I had my twins, essentially like 3 months before COVID started. So I had my twins in November of 2019. So just when they had like hit the point at the 3-month marker where it's like safer to like take them out and, expose them to more of the environment. One of my daughters was in the NICU, so we had to be a little more cautious with her from just like exposure to potential germs before 12 weeks. But so I wasn't working at that time. I had left my practice when I was pregnant with the twins, knowing that I wanted to have a longer maternity leave than what I could have. So I helped to interview and pick an amazing pelvic health physical therapist who actually works for me now too. Her name's Becca Campbell, and she took over my caseload at that practice. And then I was just at this place where I wasn't sure what I was going to do. I knew I could go back to that practice, build my caseload, maybe do something else. I really wasn't sure what I wanted to do. COVID's going on, and Cecily Youssef, who's a doctor of traditional Chinese medicine and an acupuncturist, she owns Fertile Ground, the office we share space in Greenwood Village. She reached out to me. We had worked together on collaborating on patient care over the years, and she was my acupuncturist during both of my pregnancies. And she reached out and said, I've got a few patients that I really want you to see, Nikki. Would you come here and just see like a few people for me? I've got a room. I negotiated a really low rent because of COVID. You can come in here for a really cheap rate. And, what do you have to lose? And I was like, I guess nothing. I do need to get out of the house right now. I'm going insane here. And I want to get my feet wet again with this. At first it's like a different language. I'm like, man, I haven't talked about this stuff in a while. I don't even have the vocabulary anymore. So I went in, started treating some of her patients. I already had an LLC. And so I essentially started my practice that way. I wanted to do that just like one day a week while I was taking care of my kiddos. It was the middle of COVID, so I had no idea what would happen, but people still need help during COVID, right? Lots of it. So we were able to, stay open. We had a huge amount of like precautions in place, masks, filters, you name it, like crazy sanitizing going on. But people were coming in droves. They really needed help. So my business started growing, and then I got another day on the books, and then another day, and then I started doing some house calls because there wasn't another day available. And then before long, I had an 8-month waiting list and needed to hire Becca to come and work for me as well. So COVID actually was what started my business. So I feel really, really lucky in that sense. I don't think I would have maybe gone down that path had that not all aligned in the way that it did.
And see, a lot of COVID was a catalyst, whether for good or bad.
100%.
You know what I mean? It was some people like, I'm gonna take action now, or some people like, well, they kind of got screwed because of it. But there was some people that did come out, I'm gonna go ahead and try it if the world's gonna end anyway, right?
Yeah.
And those poor, I don't mean to make them sound like victims, but pregnant women were really, really negatively affected by COVID. And the statistics on maternal health in this country are outrageously bad to begin with. But I saw a huge influx of pregnant patients just that had a lack of care. That exists anyways already, but it was heightened during COVID. Oh, no, you don't need to come into the office. Oh, like that postpartum check, we can wait another month. Oh, your kid has a runny nose. Sorry, you can't come. So, those folks really needed help. And we could do a lot of that through telehealth, but they were craving in-person interaction and someone to take a look at them. Even just checking vitals half the time. There's some critical windows there for everyone, but especially for postpartum women where they are having a huge gap of care.
Yeah.
Especially when it's needed. You're going through hormonal changes, your body's changing. You need to have hands-on help with that. And I can't imagine one of my friends does prenatal psychology. One of his thesis was, women who go through traumatic events when they're pregnant versus not are going to have kids with issues, anxiety, depression. And his thesis was right. So I can't imagine how those children and those mothers are affected because of that epigenetics or those environments that cause them to not get the care they needed.
Yeah, totally.
When COVID hit for me, so I was practicing personal training. I'd been doing it for 8 years, had my own LLC, and I was also running a music business. So I was playing 3 or 4 shows a week. And so I had this, and I just had this routine it was my favorite time in my life. And so when COVID came in and shut everything down, one thing I realized was how much I needed that routine. Like, I clung to that routine so much. I didn't realize I had set my life up and my whole environment to help my mental health with singing and practicing and eating, prepping meals, and then talking fitness. And when COVID happened and all that got taken away, it was such a wake-up call for me to realize, like, I had set my life up, and now those were all the things that protected me and kept me healthy. What a time to be alive, and it was tough for all of us.
Definitely.
Well, definitely tough for all of us. So let's try to get into some happier territory here.
Please.
Sure.
Let's get happy. All right, so kind of getting towards the end of the podcast here. So we've talked about preventative health. What are like 2 or 3 things that someone at home now, and they say they might be having these issues, they might be a little scared to come talk to you. We'll obviously give you a plug here in a little bit about how to be reached. But what are some things they can do at home to check their pelvic health or try to help it out or try? Yeah.
Sure. I love that question. So one of the things I'm teaching just about everyone is to count the urine stream. So the length of your urine stream gives you a window into your bladder and pelvic floor function.
Like 1 Mississippi, 2 Mississippi?
You got it. Okay. Yep. So when you start the stream to the time that you end it, it should be around 8 to 10 seconds long. If you are frequently having 5-second streams, there's a number of things that could be happening, but you might be going too frequently. You might be going when you don't really need to go. So there's a number of strategies that we can teach for that. But just recognizing that alone, if you're going 5 seconds, think about the urgency that you had that made you go. Did you even have a sense of urgency, or did you just go because you walked past the bathroom? If you just went because you walked past the bathroom, stop doing that. Wait until your bladder tells you that it needs to go. And our bladder function, when the muscles of the bladder are relaxed and filling throughout normal life, when the bladder hits about half capacity, it contracts. That sends a signal to the brain that's a warning signal. We all get a warning signal saying, hey, you're going to have to empty your bladder in a little while. Most of us don't even really register it. It's like, okay, after this workout, I'm going to go pee. Or after this meeting, I'm going to go pee, or whatever it is. That's a warning signal. But some folks go at that warning signal. If you go at the warning signal, instead of waiting until the full-time signal comes, which is a more powerful urge signal, you're going to retrain your bladder to go really frequently. So if you're dealing with frequent urination or urgency, leakage with urgency, just changing your behavior on listening to your bladder is huge. And if you're potty training your kids, teach them. Is your bladder telling you that you need to go? It's okay before you leave the house to say, let's go in the bathroom and listen to your body. Check in. Do you think that your bladder might need to empty? But not, you must sit down and try right now, because that's teaching the muscles to work improperly. So count your urine stream. Should be about 8 to 10 seconds. You should be going every 2 to 4 hours, or about 6 to 8 times per day. That's if you're drinking like 32 to 64 ounces of water. So yes, this is going to be skewed a little bit dependent upon how you drink, but not that much. So count the urine stream. That's one big thing. The second thing I would say is that everyone can feel their pelvic floor muscles by just touching externally. So if you take your hand and you drape it over, we'll do this right here, right now, okay, guys? So you're gonna stick your hand on your butt and stick your fingers like in the crack gently, so it's kind of cradling your tailbone, okay? You don't need to be pushing hard, just a gentle cradle in there. And it's okay if you're not right on your tailbone if you don't know quite where that is, okay?
I just pushed real hard to begin with. Whoa!
This is quite the scene, everyone.
I wish this was videotaped.
So if your fingertips are there, kind of right next to the anus, if you do a pelvic floor contraction, if you think about stopping your urine flow, or squeezing your anus closed, you're in an elevator and you want to hold back gas, you're going to squeeze that tissue. You should feel that pull up away from your finger, lift up against your finger.
Oh.
Do you feel it?
Yeah.
Yeah. And when you release, you should feel it release back into your finger.
That's crazy.
Yeah. So right away, like people who think this is so abstract, they don't know what the heck their pelvic floor is, or they're a man and they don't have a pelvic floor, which isn't true. You can all feel your pelvic floor externally. I would encourage folks, if you can't feel that lift and release, there's probably a little bit of muscle dysfunction going on there. And that might couple with symptoms like incontinence, difficulty emptying, sexual dysfunction, and that would be a time to go see a pelvic health physical therapist or talk to someone about it.
Oh, absolutely love that. Any other questions before we let her plug her thing?
This was absolutely amazing. No, I'm good. It was incredible.
Yeah,
Go ahead. Yeah. So
thank you so much. I mean, there's obviously tons of more questions that I have wrapped up here, but we're kind of running out of time. Why don't we go and plug you, where you're at, how we can find you, everything.
Sure. Well, thank you guys so much. I told you when I came in that I was drawn to come and do this with you just because you guys are really genuine.
Thank you.
And I love that 2 males were asking me about pelvic health PT. So that just spoke volumes to me. So it's really, it's an honor to be here with you guys. It's exciting. I think a lot of what we're doing really overlaps in a lot of ways. But my practice is called Popper PT. My website is popperpt.com. I have online booking there. My other doctor of physical therapy, Dr. Becca Campbell, she's an amazing, very well experienced pelvic PT. She's newer to my practice, so she has a lot more availability than me right now. There's online booking available for everyone, for me and Becca, new patients, existing patients. Dr. Becca could get someone in within a few weeks. I'm a few months out right now for booking. I also have an Instagram account, Dr. Niki Popper, where I put a lot of reels up on tips and tricks for pelvic floor, all things pelvic health, not just pregnancy, postpartum, but tons and tons of tips, lots of headache prevention, postural stuff. So you can find me on social media and on my website.
Well, Doctor, thank you so much for coming in here, explaining your story, explaining the issues that are going on that people aren't really talking about enough, and trying to normalize a problem that needs to be solved. Thank you, Brett, coming in here, doing your thing, dude. I also want to thank everybody that's been listening to us the past 3 months. Mm-hmm. We went from just a podcast in Denver to international all over the place within a few months. We're all over the place in the United States. It's because of you guys, the listeners, and because I think we do have some really good, interesting conversations, and this was an amazing one. Can't wait to have you back on down the road and see how much we've grown from then.
Definitely.
Make sure you guys are going to www.ascendperformancetraining.com to check out what we're doing with blogs. If you guys are interested in personal training, go check us out there. We also have our supplement line, Kalevala Labs. It's on there as well, too. Make sure you guys are checking that out.
I'd like to shout out Laguna's Coffee, one of our sponsors.
Laguna's Coffee, you got to check it out. We'll have our own little station here in the next few weeks. So if you guys want to try out some coffee, come out that way. And then if you guys are interested in genetic testing, go to our website, click on genetics, and put APT for 30% off. So thank you guys so much for listening to the 17th episode of Health or High Water. Peace.
Peace.